Hi everyone, and thank you so much for inviting me to your workshop. My name is Linda Molander, and I work at the Public Health Agency of Sweden as an environmental health analyst. My background is in toxicology. I did my PhD in regulatory toxicology, where a lot of research is focusing on how to account for mixture of chemicals, exposure to mixtures of chemicals. And if that can get quite complex, the exposome research is studying even more complex interactions where chemicals are just, well, one of many types of exposures. But this is, of course, what the world looks like, and therefore it's very important and relevant to study it and also think about how this can be integrated into policy. So this workshop is really interesting. I will give some examples of how we account for co-exposures, health synergies, and how we integrate equity in the environmental health work that we do at the agency, and also what research and policy needs we see is needed forward. So yeah, next slide, please.
Just bear with me a second, I think because you have control, I can't do anything. So what I'm going to do is I'm going to try and take back control.
I can give it back. Should I?
Yes, give it back, maybe, if that's okay.
Ah.
Something happened. Was that me or you?
I don't know.
Have you stopped sharing or you stopped control?
Okay, so you take it forward. Okay. I thought I'd just say a few words about the Public Health Agency and our assignment. We are a national expert authority with overall responsibility for public health issues. And our mission is to strengthen and develop public health. We were formed in 2014, and we are now over 600 employees situated in the Stockholm County in Solna, as well as in the north in Östersund. So the next slide, please. Yes, we work to ensure good public health and to ensure that the population is protected against both communicable and non-communicable diseases. And we work to develop and support the work of different actors in society. So we work through, as well as together with others, to promote health, prevent illness, and protect against various health threats. And we pay special attention to the groups of people with the greatest risk of suffering from ill health. Next slide, please. And yeah, good health is the most important thing in life to most people. And in Sweden, public health has improved significantly over time and is generally very good, but not for all. Average life expectancy, as you know, is one of the clearest measures that we use to look at this. And it shows that we're in some groups with lower socioeconomic positions, it is actually decreasing. We had this new data on this published just a few days ago. And also related to today's topic, there are also still inequalities in exposure to environmental factors and related health effects. And I will come back to a few examples of this soon. Next slide, please. So when it comes to environmental health, the agency's task is to detect, prevent, and eliminate health hazards in the physical environment. But of equal importance is to promote the positive environmental impacts of human health. And we do this by giving knowledge support to different actors, to local, regional, and national actors, the government, international actors as well, about how the environment impacts our health. And we provide supervisory guidance in accordance with with law to local and regional environmental health officers on health protection related primarily to indoor exposures, so in residential and public dwellings. And we also have the assignment to monitor the population's environmental health, and we do this mainly by a population-based survey that we conduct every 4th year, alternating between children and adults. And this survey provides data on self-reported exposures to different environmental factors and related health effects. And they include, for example, noise and air quality, access and time spent in green spaces, indoor environment factors, and like chemical exposure and temperature. Also about, we ask questions about climate change and if people are worried about that, transportation mode and so forth. So it covers a broad range of factors. Next slide, please. As part of our assignment, the equity perspective is, well, it's integrated in practically everything that we do, meaning that we study potential differences in exposure and vulnerability between population groups when we do analysis. And we pay attention to unequal conditions that exist to, for example, do something to change your situation, to minimize exposures, for example, and look at the prerequisites that different groups in the population have to manage health risks. And what you see here is an example from a recent government assignment that we had with the aim of suggesting measures to lower the risk of respiratory problems among children related to air quality, where air pollution levels were modeled around all Swedish preschools. And it showed that many of them are located in areas with air pollution levels above the WHO's health-based guidelines. And that is what you can see in the pictures to the right. It shows the number of children going to preschools with different levels of air pollutants on the x-axis. And that many of them exceed the air quality guideline, the red line. I see now that something have fallen out, but on the top of the top graph shows levels for PM 2.5, and the lower one is for PM 10. But this analysis also showed that the pollution levels were generally higher around preschools that were located in areas with lower socioeconomic conditions. Yes, the next slide, please. Thank you. And so here's another example with data from this National Environmental Health Survey that I mentioned that shows that the lower the level of the education among the guardians, the more exposed to environmental risk factors were their children and themselves, of course, such as living closer to traffic and in more crowded households. This is not in this picture, but the same pattern was also shown for reported bad air quality, noise disturbance, and also less time spent in green spaces. That was also related to lower educational level, for example. Next slide, please. So in guidance and policy recommendation, and when deciding on what interventions and actions to take, we always try to find and point to the synergies and co-benefits to prioritize and guide among different intervention alternatives. And this requires having this overall health perspective that looks at different environmental health factors, co-exposures, and how different groups of the population are affected. And we work quite a lot, much in collaboration with other agencies and actors to strengthen equity and health promoting perspectives in spatial planning and management of the physical environment. So for example, we've heard it previously by the other speakers, but by promoting active modes of transportation, several benefits to health can be made, including, for example, improved air quality, lower noise levels, increased traffic safety. You can make room for more greenery, for example, which will also increase climate change adaptation. So there are a lot of win-wins for health, the environment, and the climate to be made with this, having this overall perspective. Next slide, please. So yes, there's a need for this more holistic perspective on health. And I think it's what I wanted to show here and say with this picture is, I think it's quite interesting to compare environmental and health regulations. So in the EU, for example, we have the Water Framework Directive and the Marine Strategy Framework Directive, which both aim to achieve a good ecological and chemical status of different water bodies. And both these directives, they have this ecosystem perspective and consider the joint impact of different anthropogenic stressors, chemical and non-chemical ones. But at least to my knowledge, we don't have a corresponding regulation for human health that considers the joint impact of environmental factors. And I'm not saying that such a legal act is the way forward in the health sector, but maybe these perspectives can inspire policy development, which is also what the exposome is about. Yeah, so I think it could be an inspiration to policy development. Next slide, please. Yes. So to summarize, we see that the equity perspective needs to be strengthened in both policy and in research, included in studies on exposure, health outcomes, socioeconomic calculations, etc. And also that there's a need, which is also expressed by our target groups, to develop indicators to better monitor environmental health. And that is include more aspects of health and look at it from an equity perspective. And for that data, more research is needed. And I think we also have an important task to pay attention to the long-term effects of various measures, not to make decisions based on short-term effects and economic gains. And I think this is important in research too, to study the long-term effects of environmental exposures even more. And within environmental health, there is also a need for more research that evaluates the effects of various interventions in order to identify which ones are the most effective and provide the greatest social and health benefits. And I would also like to highlight the importance of cross-sectoral research, cross-sectoral collaboration, which I think is crucial to find these synergies and the co-benefits. And lastly, I think the exposome research field it's very interesting, relevant, and I think it can contribute with new important knowledge to strengthen environmental health work. So I'm really looking forward to hear more about your results here today and to think about how it can inform policy. Thank you very much.